Okay, welcome back. Today we're going to talk about a topic that I hear questions about all the time. What is lumbar spinal stenosis? It's a very ambiguous question, really, and the answer is not so straightforward. We're all going to get it. Yeah, that's right. Every one of us is probably going to have lumbar spinal stenosis. I kind of describe it as a car. You drive it around for 100,000 miles, you're going to see wear and tear. And that may not happen right away. It happens gradually. But first, let's go in and let's go meet our patient who has lumbar spinal stenosis.
Patient's ready to go.
Patient's ready. Hey, hello. Thank you. You're already waiting there. Okay. It's easiest to demonstrate on a patient as well. So if you kind of look at this layout, this is really a very accurate anatomical layout of how the spine fits. We have the cervical, we have the thoracic, and we have the sacrum, and here is the lumbar spine. We've moved a couple of ribs out of the way, but in a short form, this is how our lumbar spine is. Now we're missing a couple of bones here. We're missing our iliac crest, which is, if you feel on the side, you'll feel that protuberance. So lumbar spinal stenosis, we have to think about it really as a tunnel. So as with any tunnel, here's the Lincoln Tunnel, or, we're in New York, so here's the Lincoln Tunnel, and cars are driving in here and they're coming out here. This is, imagine, instead of cars, we have nerves. So the nerve is traveling in the tunnel. Well, where is this tunnel here? The tunnel is right here. You can have a look. That's where the tunnel is. And these yellow flimsy things here represent where the nerves come out. You can kind of see that. Now, we'll go through some of the anatomy, and we have another tape where we talk more about the anatomy. But suffice it to say, there's a tunnel here. Now, there's also a tunnel this way. We call this the central spinal canal, and this we called it lateral meaning out to the side, and here it is, right and left. So again, begs the question, what is lumbar spinal stenosis? So I have a segment of the lumbar spine, the two bones. This red jelly material represents the disc, and this yellow represents the nerves that are coming out. You can see here is our tunnel that we talked about. So what can make the tunnel smaller? Well, one of the common things that makes the tunnel smaller is degeneration of the disc. And that makes sense. If this disc is getting smaller, little hernia coming out here, you can see that this nerve out here is starting to get squeezed, right? It's starting to get squeezed. Now, that is spinal stenosis, that narrowing of the tunnel. Now, the tunnel can be narrowed either by the disc, which can start herniating into this area. It can start pushing out like that, okay? Usually it's not the main cause, but more commonly, it's because of degeneration of the disc and this tunnel becoming smaller. Now, this joint here, we saw this in our anatomy video, is called our facet joint. It allows our spine, lumbar spine, to move left and right. And what's happening here is arthritis grows inwards, and it also causes compression and spinal stenosis. So now everyone says, well, how do I know if I have spinal stenosis? Well, you'll have pain down the leg. That pain is usually when we walk. The classic example of lumbar spinal stenosis, someone will say, yeah, hey, doc, I can walk maybe 2 blocks, and then I just have to stop and sit down maybe 5 minutes, and then I'm good to go again. Classic lumbar spinal stenosis. That nerve is squeezed, and the nerve and the blood vessels, they get tired out. They can't pump enough blood, and the nerve is irritated. It causes pain. We stop, rest, everything kind of recharges. And that walking distance, whether it's 1 block, 100 feet, or 10 blocks, determines how serious that lumbar spinal stenosis is. And what makes it better? They go, oh, when I shop, I lean over that shopping cart. Oh, that just feels good. Well, it does, because what happens is when we bend forward, we're going to kind of get a close shot there. When we bend forward and we lean forward, look at that. We're opening up the tunnel. We're opening up the tunnel, and that is actually making it feel much better. And when we bend backwards, oh, we're making that tunnel smaller. So people often say, oh, when I lean forward on a shopping cart or put my hands on the kitchen counter, oh yeah, that feels good. It leans forward and we have some relief. So that is basically what lumbar spinal stenosis is about. Now we have treatment options, and we'll get into that into our next video.